Hi everyone! Today I'm going to be talking about a genetic disorder called Neurofibromatosis type 1 or NF1. So let's get right into it. Neurofibromatosis type 1 is a condition in which non-cancerous tumors form in the brain, spinal cord, and nerves due to an inherited mutation in the 17th chromosome. For general knowledge, there are 3 different types of neurofibromatosis: type 1, type 2, and type 3. Type 1 generally appears in childhood and can cause bone deformities, learning disabilities, and high blood pressure. Types 2 and 3 appear in early adulthood and can cause hearing loss, vision loss, difficulty with balance, and chronic pain throughout the body. However, we will only be focusing on neurofibromatosis type 1 today, as NF1 stands for neurofibromatosis type 1. As stated earlier, the NF1 gene is located on chromosome 17, which is the gene that produces neurofibromin, a protein that helps regulate cell growth on nerves. When the mutation occurs, this cell growth process is no longer regulated, causing tumors to build up. In most cases, the tumors are benign. However, they can become cancerous. Roughly 3 to 5% of people with neurofibromatosis type 1 can generate a cancerous tumor, and this arises from the neurofibromas under the skin. When these sarcomas appear, they grow much faster, invading nearby structures and sometimes metastasizing to other areas of the body. This mutation in chromosome 17 is inherited, as it is an autosomal dominant inheritance pattern. This means that any child of a parent who is affected by the disorder has a 50% chance of inheriting the genetic mutation. Some symptoms of NF1 include flat, light brown spots on the skin, which are known as café au lait spots, as we see on the top left corner picture, freckling in the armpits area, tiny bumps on the iris of the eye, also known as Lisch nodules, located on the bottom left picture, soft pea-sized bumps on or under the skin, which are the neurofibromas, bone deformities, which are both the middle pictures, as scoliosis is a bone deformity, tumors on the optic nerve or optic glioma, and learning disabilities. As of now, there isn't a cure for NF1. However, there are many ways to treat the effects of the disease. One of the treatments includes surgical removal of the tumor, although there is a risk of the tumor regenerating. For optic gliomas, treatment may include surgery and/or radiation, and for scoliosis, treatment may include surgery again or back braces. Some other treatments can include chemotherapy or radiation therapy, as shown in the 2 images. The first one depicts chemotherapy and the second one shows radiation therapy. There are also some clinical trials being conducted currently on the cure for NF1 by the National Cancer Institute in the Pediatric Oncology branch. A fun fact about neurofibromatosis type 1 is that it is the most common neurological disorder caused by a single gene, as it occurs in 1 in every 3,000 children born. To sum it up, neurofibromatosis type 1 is an autosomal dominant inherited mutation which leads to the growth of tumors in the brain, and nerves, and spinal cord, which can be benign or cancerous. Thank you everyone for your time, and I hope you found neurofibromatosis type 1 as an interesting and fascinating genetic disorder. Here are my resources. Thank you.